Texas often puts Band-Aids on things that require surgery. And that has historically been at the detriment of women's health. And right now, I would say, knowing that here in the States, we're under maternal health crisis, a crisis, extending Medicaid to 12 months is the least that we can do. It's the bare, it's really the bare, it's the basics. Healthcare is a human right. And if we put the pressure on women and birthing people to carry children and raise children and take care of children for the next 18 years, then we need to make sure that the people that are carrying these babies and raising these babies are cared for. I'm not sure if many people understand that the vast majority of maternal deaths happen after birth. And 80 to 90% of these deaths are preventable. And so this just seems like if we know that we're in a healthcare crisis, then we need to get to the root, you know? And Black and Indigenous women are 2 to 3 times more likely to die from childbirth-related causes than white women. And I want people to also understand that, like, what a pregnancy-related death, like what it's one that occurs while pregnant up to 1 year postpartum for any cause related to pregnancy, that any cause related to or aggravated by pregnancy or its management. Okay, so up to 1 year. Okay, so just imagine someone, just kind of give you an idea, imagine someone who is 3 months postpartum, Medicaid has run out. This is no longer baby blues. This is depression or psychosis. This parent maybe wants to continue breastfeeding, but is having a lot of challenges and doesn't have the care and the support needed to continue on their breastfeeding journey. Having extended Medicaid, a basic human right, really, healthcare, can already reduce the level of stress that occurs when someone has just had a child, knowing that they can contact their OB-GYN up to a year after they've given birth to receive the necessary care that they need. Because a body is not done, hormones are all over the place. You know, a body does not just go right back to normal. It's time for us to start treating women and birthing folk like with the dignity and respect that they absolutely deserve, especially when we have placed the burden of responsibility on them to continue to raise a child and continue raising a child for 18 plus years, you know? So this is basic. My prayer is that people will understand the humanity, that they would be gracious, that they would see that people are deserving of kindness and gentleness and compassion and tender loving care. And this is basic. We haven't even got into cultural relevancy, cultural humility, cultural diversity, all of that. We haven't even gotten into systemic racism. We're just trying to provide basic healthcare.
14% of those maternal deaths are due to a lack of access of healthcare or financial resources, or something interrupted a system referral or some access to treatment. 23% of maternal deaths are related to a mental health issue or a substance abuse or misuse disorder, which means that often how these mortalities manifest, it can be subtle, it could play out over time. And that's what we're asking for here is time. Last week, I met a patient in our halls. We had not seen her since her last pregnancy. So it had been about a year, maybe a little over a year, and she had this belly out to here. She's 35 weeks pregnant now. And then behind her, she was pulling a wagon with 3 little ones, like 5 and under. So this will be her 4th baby. Which was pretty genius, I thought, with the whole wagon and stacking these kids. It was pretty adorable. So we just were catching up and talked to her about what had been going on since discharge. And she filled me in that after her last birth, before she was discharged, after delivering, she was counseled on her contraception options. And at that point, she chose to receive a depot shot in the hospital before discharge. And then she went home and life returns to normal, how it does, right? So her 6-week postpartum appointment rolled around and she described having challenges with both childcare and transportation. And so she was not able to make her postpartum appointment. And that's where we lost her. We never saw her again until a year later. As it turns out, she never got a chance to return for contraception before her Medicaid expired. And that happens all the time. Life just gets in the way. I think that's the thing is about that 6 week is you have this sense of like, oh, okay, everybody's kind of back to normal. I mean, my job certainly expects me to be back at work. Everybody else expects me to be back to normal. But as we know, postpartum, physically, emotionally, mentally, is sometimes years long in the process. And if you've given birth before, you know exactly what I'm talking about. So as I continue to talk to Alex, I was asking about her children and her oldest son. I was like, well, was he able to go to pre-K? And she's like, actually, no, I've had a lot of trouble potty training him. So I've not been able to enroll him in pre-K. He still hasn't gone into any kind of school-based setting. And she just kind of expressed a general understandable feeling of being overwhelmed, especially since she's due to give birth here in 3 or 4 weeks. And I use this story because I meet Alex's all the time, and this is really what it looks like. It's the felt ramifications of, in her case, not being able to space out pregnancies to a healthy interval. The ideal would be 18 months. And the whole family benefits when she's able to make that choice and to plan her pregnancies. Those delays in his not being able to enroll in pre-K, it signals a delay in her son's school readiness and performance. So do you see how it ripples into the whole family? And a big theme of my work is Medicaid is preventative care, and Medicaid extension is preventative care. It's certainly less expensive than those health events that will ultimately happen one way or the other. It's just they're more costly and more dire after the fact. My prayer request is for the momentum to continue to build. Many of us are mothers, and I pray that we can capitalize on that shared experience, that shared humanity, that this issue triggers something within us all to remember those days, to know what that's like, to not to feel helpless, or to recognize how important how crucial that support is into our ability to parent. And for me personally, my advocacy in this arena is an extension of my faith. It's a way for me to practice my faith. And I don't get an opportunity often to state that publicly and to connect those dots. And so I'm very thankful for this conversation today.
And this has a special place in my heart because I lost my mother 2 months ago in February. But the reason this sort of advocacy is close to me, well, both because of what I heard from both the speakers, but I know firsthand just growing up how my mother's health, so went my health and my family, and I can look back at that historically. And so I'm really, it's an honor to be able to be here with you all and to be able to pray.